Yes, good morning. So I think this is the fourth webinar concerning the preparation of the hackathon. In those hackathons, what we want to try to do is always make a reminder about the logistics of the hackathon, and Dimitrios will help me on this, and also present the specifications of the project as they have been developed so far. So we have already seen the discharge letters and the lab reports, both in CDA format. And today, with the help of Sofia Franconi from IHE Europe, we hope to have a short overview of the medical imaging part. I guess it's going to be using RDCore again. And Dimitrios, we have also a small session from our side, right, at the end.
Yes, you are right. There's going to be a very short introduction and presentation of the medical discharge, hospital discharge letters.
Yeah, in the fire domain, and we will continue this discussion next week. Okay, so then Dimitrios, the floor is yours. Just to make a small reminder, and then we can give the floor to Sofia and present us the specifications in more details.
Okay, thank you, Alexander. I will share my screen now, and I will try very briefly to give you an outline about the logistics of the hackathon, which, as most of you already know, is an online event. This is the agenda that Alexander just presented. So mainly, it is very important for everybody to know why everyone might want to participate in this event. There are several reasons. The first reason is to demonstrate his or her support to international standards, and also it is a very good opportunity for projects and vendors for publicity and demonstrating their commitment and involvement in the digital health domain. Of course, there are some more concrete incentives that are relevant to the fact that everyone participating can be recognized as an active member of the X-eHealth community of practice. And there are certain sections of the web page of the projects where somebody can declare the corresponding willingness. Of course, the best idea will be that will be selected will be included in the X-eHealth Innovation Day. That's a conference that's expected to take place sometime later this year, and also some of the very best proposals will be able to participate as candidates for the X-eHealth Interoperability Award. So there are a lot of incentives for anyone interested in participating in these events. Of course, already a chronic disease management scenario has been uploaded on the webpage of the projects, demonstrating possible areas where the use of the standards developed by X-eHealth can fit. Possible areas of simulation are, for example, the visualization of lab reports, discharge letters, and medical imaging reports. Of course, some other areas of simulation or demonstrations are relevant to the exchange of examinations between health professionals, the incorporation of standardized documents within personal health records, the support of research activities, and of course the standardization of the incorporation of electronic health record data into medical registries. There are a lot of possible scenarios. So some of them we can imagine, and some of them are up to you to bring them into our attention. So what is important for everyone to know is that the deadline is very close. It's on the 27th of May. Already we have some registrations, so that's very important because it seems that there is a lot of interest for participating in this event. Regular meetings are held every Tuesday between May 3rd and the 7th of June. And between 10:30 and 11:30 Central European Summer Time at this spot. And of course, we can organize separate dedicated calls for each team if that is needed. All the information is available online, and if you have any question, any doubt about what it is needed for your registration, please send us an email on this mail address. Of course, we do not expect to have everything, a full proposals that can be fully tested. So it's very good if we get proposals that are relevant to projects, products, or any idea that may come in mind. Participation also is not limited to specific organizations or projects, meaning that even a small team of 3 or 4 people can form a team and participate in the event. I will conclude this very short presentation by letting you know about who organizes this hackathon event. It is, of course, organized by a specific work package and task of the X-eHealth project that is led by the Hellenic Ministry of Health, with the support and co-leadership of HL7 Europe. The hackathon is supported by HL7 Hellas, where I come from, which is the Greek affiliate of HL7 International. So I will stop this presentation here. I don't know if Alex, you have something to add.
No, I think it's just a small reminder that we do every week for the newcomers that we might have. Before going to Sophia, I see that Vincent wants to say something. So Vincent, the floor is yours.
Well, just want to ask you something. Could you send this presentation? Can you share that so that we can share it with our...
Yes, actually all the presentations made so far are available online together with all the previous onboarding webinars. So this is going to happen to this one as well.
And available online, where?
They are available online in this URL.
Yeah, okay. In that link. Oh, okay. Yeah. Okay, great.
It's the URL of the hackathon. So one place for everything.
Okay. And one more question out of curiosity, why you call it the Hellenic Ministry of Health and not the Greek?
Because Greece in Greek is Hellas, so it's Hellenic, the adjective.
Okay. Yeah.
It's the right. It's the real Greek word, in fact.
Okay, yeah. Just out of curiosity. Thank you.
Good. So Sophia.
But we have a good mapping between the two terms.
Yeah, it's
indeed. Auto translate. Yeah.
Well, the Hellenic goes a little bit further in the past from.
Indeed.
Like the Greek. Greek came up after the Byzantine Empire, so it's more or less the same, but the origin of the word is different.
And what does Hellas mean?
It's the name of, it's like Italia or the
yeah,
Netherlands
yeah,
or
yeah.
Holland, maybe.
Yeah, but that has a meaning. That's a flat land.
Yeah.
No, but I understand. Okay, yeah, thank you.
It's the land of the Greeks, so more or less that's the
Yes.
meaning. Anyway, Sophia, the floor is yours. Please enlighten
Yes.
us on the medical imaging domain and what we should expect and what we could do in the hackathon. Thank you.
Okay. Thank you, Alexander. Hello, everybody. I will have first small presentation, and then I will continue with art decor. So I'm going to present you the part of diagnostic imaging report. As was maybe already explained in the previous webinars, to build a specification, we took the use case specialized in Word Package 5 that were supported by information model, and then that we took this information model to build the specification that we have in RDecor. So we have two types of specification. We have the CDA specification that I will present today, but we also have a set of flyer specifications that are preliminary for now, but I think you will be able to retrieve the link after to see the specification if you are interested in. So when you go into art decor, you have two types of interface. You have the interface that we see here, the human readable interface that we will see today, but we also have the XML part of the specification that is used to then test and validate. So when you go inside of art decor, it's built like a CDA document. Here you have the example of the diagnostic imaging report that I will show later. And you can see that you have the document level templates. So here it's open the diagnostic imaging report. And inside of this document, you have the header level templates, the sections, and the entries.
Sophia, could you go back one slide? This is the presentation that you're going to present as well at the hackathon, because there's a little typo in the previous slide.
Oh,
Yeah.
which one?
Yeah, the previous slide. Yeah, it's readable. No, no, we have not seen these yet.
Yes, we already saw this one, I hope.
No, the one that you were just showing, and then one before that, where you explained the two different human readable and machine processable part.
This one.
This one. That says readable, so it's.
Oh, yes.
Yeah,
I will correct that.
Sorry.
No problem. It's in the deliverable, so that's good to know. So where I was saying, yeah, and to build the specification in art decor, we based our work on some documents, main documents. So the main one is the DICOM part 20. That's a specified template for the encoding of imaging reports. That's I will explain it later, but that's the main document that we use for the specification. Then we also based our work on the HL7 imaging integration. That is an implementation guide that describes how the CDA is used. We also used the IHE management of radiology report template profiles that specified a data model for templates that will serve as a format for how template can be transmitted between systems. And also we saw some example of radiology templates in the RSNA website. So that cannot, yes. Sorry. So if you go into
Sophia,
yes,
should we mention also the XDLab profile in the previous slide?
we did not use it for imaging.
Okay, so I thought that this hackathon would cover lab as well.
No.
Oh, it already did in the last webinar. here it's just a focus on the imaging.
Sorry.
No problem. But yes, just a focus on the imaging part. So we did not use lab profiles for imaging. But here you can see that there is also XDLab, but to build a specification, so we used some repositories and most of all the DICOM one. So the first step was to take the DICOM specification from the DICOM standard, build them, implement them in RDecor, and then do the reference between the DICOM templates and what we have for the X-eHealth project. So I propose to go to RDecor to see. So here you have the RDecor interface, where you can see on the left your document level templates, and then, as I was saying previously, you have the header level templates, section level templates, and entry level templates. So if we go inside of the diagnostic imaging report, we will see first, so I will hide the tree so that we can see better. So you have kind of the identity card of your template. So here you can see that it's the ID is for the European Electronic Health Record Exchange format. And you can also see here that it's a specialization of a DICOM template. So in RDecor, you cannot change a template that is already into another repository. You can, but it's better to copy and paste the template, to not change it, and then you just specialize it and you can add everything you want inside your template. So if we go inside the template, so it's a clinical document. So you have all the basic information that you have in a document. I won't go into much detail in that because it's the same and you probably already saw it in the previous presentation. But for example, you have the effective time that contains the date and time of creation. It's not laboratory, that's a mistake, but imaging report. And then you will have the header level templates. For example, here they are all included inside of the document. They have been specialized from CDA to X-eHealth. So to specialize them, we add the prefix XEH because we modified them. There are some from the CDA, other from DICOM. For example, this one, if we go inside this header level template, we'll see that it comes from DICOM, so it has a DICOM ID, and then you have all the elements that are needed inside your in-fulfillment of templates. So those are, you have all the description for each element to be sure that you know what it does and where it comes from. So that's the, yes.
Yeah, so sorry, the word included, what, because you have a repeating included here, but you don't know what it is. Is that something that you can click on the arrow so that you see what it's in there?
Yes, so the include, it's that you have your document that, how can I explain that?
Yeah,
and then you
within the document, but at the least you should have like a title maybe, or am I wrong?
The title is here. You can see here where it comes from. Just to include, it's how you can retrieve some templates from another repository or another space. Here, for example, you have all your header that are here. For example, I showed you, I don't know which one I can show you, but X-eHealth result validator. That it's a header level template that will be included inside of your document. So here, I guess you can see that it's used. Yeah, it's used in the diagnostic imaging report. That's the one that I was showing you.
Yeah.
But I don't think there are other ways to.
Well, I was wondering because it makes it less readable if you only see included and you don't know what it is that it is being talked about. Should have like a title, maybe.
I'm not sure we can add. Maybe we can, but.
Hinek? What do
Yeah.
you think?
I'm not sure we can include it here.
That's not
So
very.
this is the standard way how Ardicor is displaying templates being included into the main template. So she cannot modify this.
Okay. Yeah.
But you have all the information.
And sorry, and Ardicor is a technical way of communicating. We are enriching Ardicor description with example, but we can't think this is a sort of a support document to teach everything to everybody.
No.
So this is an item for a specialist. So this is the point. If we dilute and we make too long, too weak, we will lose the efficiency and the efficacy.
Okay.
No, it's like you want to change and explain the cardinality. Cardinality must be as we are expressing. So, well,
yeah,
there could be guidelines, and the guideline will be guideline. This is a computable language.
Okay,
Thank you.
with lots of text. Okay, I'll stop here.
Human readable, computable. Somebody argues if it is human readable or not, but yeah.
A subset of human. My director will not read, maybe.
Yeah, and we try to explain, to put example. You will see on the other templates, to put as many as description and example as we can to help understand from someone that is not maybe less technical, that can at least understand which template is for and what does it do. And maybe if I can help you understand, because here I didn't explain. Here DT, it's the data type. If you click on the data type, you can you have a list of values for your data type that you can. Here it was CS, it's coded simple value, and if you click on that, you have the more detailed explanation with the attributes and the rules.
Yeah.
And the cardinality.
It's a beautiful world, but if you have, like here, you have titles, realm code, type ID, template ID, and then when you go down, you have like included. What is that? That's the reason why I asked.
That's the way to you will see. I will show you more templates, and you will see that's the way to include some other. That's the name. The way to include other templates from another space, or even from the same space, but include the section or the entry or the header level templates inside of the document.
Okay.
So here, that was the header. All the included in gray were part of the header, and then if you go inside the body of the CDA document, if you remember the small picture that I showed in the presentation. And then you have all the main section of diagnostic imaging report. So you can see that we have clinical information, imaging procedure description, comparison study, finding, impression, and in some cases addendum, because it's not required. You see it's the cardinality 0 to star. It means that you can have one or many, but it's not mandatory.
Yeah, may I have a question on the how you call it, conformance? There's a lot of things where you say mandatory or R is required. Is that correct?
Yes, here you have a list. So
yes.
O, it's optional, R is required, M, it's mandatory, C, it's conditional, F,
yes,
fixed.
I understand. But the question whether if you make a data definition, whether you really need to make all these mandatory and required requirements, so to speak, because it depends on the use case whether or not something is required. So actually, has been some discussions also here in the Netherlands where you can say, okay, we have a data definition, and then you have a like a real template, or I don't know exactly what the term for that is, but where you actually put the conformance rules only in the actual specification of a certain document. That was also a comment on the lab, by the way, that people say, well, it may be mandatory, but if we don't have the information, what do we do? So that was.
But sorry, Vincent.
Yeah.
I would like to say that the scope here is not to go in detail and discuss about Art Decor, because Art Decor is the implementing guide where things are Cartesian, meaning all the discussion in the guideline are fixed in an implementation guide. The implementation guide defines the rule of presence or absence or optionality. Mandatory, that means the data must be there with a value. Required, a data must be there with a null flavor, etc. So this is a language from which automatically the testing tools are derived, and from which implementer are deriving things. So it is not a guideline. It is the lowest level of the implementation of the specification. So all the data that you are raising that are correct at guideline level, at European level, guideline level, at national level, now become Cartesian. Yes, maybe, no. And the data associated, when you click the value, you get the value set that is associated to that data element, nothing more and nothing less. So again, it is a computable language. We try to make it readable and understandable, but it is important that those who have to implement the CDA totally understand what is meant.
I know.
And
I've
take
seen
a packaging to see how a package can be described or it cannot be described.
Yeah.
The point is, since we have to derive the configuration file for the implementation of the semantic component, and we derive the testing tool in an automatic way, we must be clear with no doubt. And this is the reality. This is a computable.
Marcello, you're quite right.
Thank
we
you.
should not go into too much detail. Yeah, I stand corrected. Thank you.
Thank you.
So, so as I was explaining, the structure body with all the main sections. So just to keep the consistent, I found RSNA template about an X-ray ankle and foot fracture, and you can see here inside. Inside you have the procedure information. Here you have the clinical information. You have the comparison, the findings, and then you have the impression.
Yeah.
So as we did in Art Decor.
Yeah, I think we call the impression something else, or yeah, art is impression. Okay.
Yeah, we called it impression, at least in the DICOM standard, and since we copied the DICOM, that's where it comes from.
Yeah.
So if we go into a section, for example, let me check which one I have open, the imaging procedure description section, so that we can see where it's used and where it comes from, also from DICOM. And if we go inside of the templates, so you will always find the ID of the templates. Here you have a reference to the cost system. This one I think is a Loink one. And you have, as I previously, you had some includes, and here you have some contains. That means that it's a reference to, for example, procedural medication or a complication section. Here, for example, we have the radiation exposure and protection information. If I open it, we will be able to find a value set. I think it's interesting to see. So in the radiation exposure section, if we expand, so here you have some entries, because this is a section. So inside the section, you will have some entries, still have some code system, low code system, and here you can see where it is. Here you have a value set that it's about the manufactured products and the products that are radiopharmaceuticals. So if we click here, we will arrive to the value sets and all the value sets that are linked for our document. So here inside of this value set, you have all the reference to radiopharmaceuticals. So I won't go into details because I don't know them by heart, but here you have them, but you also have other value set that you can see on the left here. For example, which one are linked to imaging laterality, for example, the right, left, bilateral, unilateral, that's SNOMED code. I also had another one, image. So in the section image quality, that it's an entry image quality, you still have the template ID, the code system, and then you have here another value set for image quality assessment. And you can see the different level of image quality that you can have on your value set.
And that's from Rodlex.
Yes.
Okay. Yeah.
This one is from Rodlex. We have in imaging, I think we have Loink, SNOMED, DICOM, and Rodlex value sets.
Yeah.
So
maybe that's a good introduction to people who are listening, that we indicate which standards we're using.
Yes.
So because sometimes people say, oh, we need to use this or that, but actually in practice we use many different types of standards.
Yeah, and you can even in like here in the diagnostic imaging report, we will have some Loink code system, Loink value sets. It depends on which element. And it's I can show you also. I talked to you earlier about the XML format that you can have. So if you come back to your diagnostic imaging report, you can find your XML template here. So with all the elements, it's not recommended to change directly on the XML, because except if you are an XML expert, it's always easier to change and modify things, edit, let's say, in a larger mode into the human readable interface. But here you can see that you will have all your elements, the name, the IDs, the extension, the templates. Here here that was all the elements that you add, the basic element, and then later I think here you have the includes that I was talking about with all the reference to the header, and then at the end here you have the component with the main section of your diagnostic imaging report. So I think that's all I wanted to show you today. If you have some questions about that and about the document. Yes.
Any relation to or reference to an image itself?
In the
In Hackathon?
No, I don't.
No, okay.
I don't think so. No, this is just the report.
Okay, yeah.
I don't know, Alexander, correct me if I'm wrong, but I think it will be just the report and the CDA document.
Or we can have some images. So we have a use case and a scenario. As said, it's not the only one. Marcello presented also a rare disease, chronic disease, let's say, as well. So we are fully open to receive any ideas or recommendation, even things that we have never thought about. So that's the scope of the hackathon, to go sometimes even one step further. from our thinking, because we are a group of people. We have been discussing this for several weeks or months, and sometimes someone can drop in and say something new. So let's see. The idea is just to showcase the specification. That's why we are asking Sophia here to make a short description, so that people don't have to start from scratch and they have at least some guidance during the process.
Yeah,
Go
and
on.
if I can just add on that, so that's the basic how to navigate through the diagnostic imaging report. So the header first, and then the main section that you will have. And if you click on the section as I was explaining, you will have other entries and so on. So do not hesitate to click on one, come back. It always open a new window, so you did not lose what you had previously, and you can find your way back to the main document. Yeah, I don't know if you have other questions on that.
I guess not. So
Okay.
please continue.
Yeah, I think I showed you everything that I wanted to show you, and our decor seems to be a bit complicated today, but yeah, no, that's all right. And yes, you can find you can navigate through the tree on the left and go through all the sections and the entry specific for imaging.
Okay. So thank you very much, Sophia, for this. As said, it's also important to try to give some examples and some test data for the hackathon. So we should try as a group to create in the next 2 weeks even some simple examples, so that we can guide people to see how those could be visualized into real CDA documents or FHIR documents or whatever. So we are also working on that from our end. And Jürgen has already proposed a sample test data for the lab report that we will have a new version during this week. So we hope to try to get similar examples from other use cases or from the other set of specifications as we go on. Okay. And if we could present them next week, that would be the optimal. So that next webinar is after the closure of the registration, so we'll have the final set of participants. So it will be a more important webinar, the one in next week. So Dimitris, I think we have one more presentation for today. I don't know, Marcello, if you want to say something related to the rare disease case, anything we should consider or we should expect as a
really, I
contribution
was,
from
yeah, not contribution from my side, but a stimulus to my colleague that I maybe see meeting today, person working on on rare disease, and a stimulus was to submit use cases, an example of implementation of the patient summary for rare diseases. We are working in parallel with rare cancer, so we will have another meeting toward the end of this week. So next Tuesday we will be able to present cases and an example, and maybe even during the hackathon we can make an example of adoption of the patient summary for cancer or adoption of different solution for cancer. So this could be a way of stimulating some conversation during the hackathon.
Perfect. Thank you.
But just as a confirmation, I don't see no, I don't see people from the rare disease community here. Am I mistaken? No one is it's complaining, so it means
Okay.
we don't have here. Okay, thank you so much.
So, Dimitris.
So Nikos is the next speaker. Hello, Nikos. You can share your screen. And also, please remove mute from your microphone.
Okay. Hello to all again. I will try to share screen. I hope now you can see my full screen.
Yes, we do.
Okay, thank you very much. So I will try to do a short introduction to the case of the hospital discharge report, the third pillar of the X-eHealth for now. So when we say hospital discharge, we have a common try here to make a common EU hospital discharge report. So discharge report is mainly a formal release of a patient from a hospital after a procedure of course of treatment, for example, an episode of care. It's a very important document as a summary of the patient medical case, which reflects the dynamics of a given case based on the information available to the doctor. Usually compiled at the end of an inpatient case for each patient. And as I told you, it's a critical component of system to ensure the quality and the continuity of care. So the X-eHealth project takes some use cases from the hospital discharge report. These three use cases are what we say in scope. So the first one is the hospital discharge report for the continuity of care. It's technically it's a push. Okay. So when we have exchange, we have also the hospital discharge report for the patient now, or the patient legal representative, which is a use case that actually a doctor report this hospital discharge. And the last one is the query for hospital discharge report, which usually it's a pull action when we discuss about interoperability from third-party systems. So the information model it's a comprehensive model, include a lot of things. Now we have three main categories here: the historical and admission information, the information about hospitalization, and of course all the discharge information. During the historical and admission information, we have, of course, the patient history information and sections inside this information model. The admission, all the information regarding the admission, like the diagnosis, the medication, the chief complaint for visit, also information about the encounters. We have the problem section, allergies, immunization, etc. It's all very known for, I hope, for all of you. The next category has to do with hospitalizations, and here we have, of course, the medication sections, some lab results here during the hospitalizations, the procedures, of course, the important vital things during the patient treatment, etc. And the final category has to do with the actual discharge. That's very common to all the EU countries. We have a very important information regarding the discharge diagnosis into one section, the discharge medications, and of course, during the continuity of care, we have the plan of care sections and some other information regarding the studies and summary sections. So, Sophia made an extensive presentation regarding the art decor. I will not dig into the art decor. It's fairly complicated for a lot of people. What is important to see regarding the hospital discharge report, regarding the representation of the specification to the art decor has to do with that we have also here a document level template, one document level template. Here we have additional header level templates, of course sections and entry level templates. One very important thing here is the relationship. This when we click in the hospital discharge report at the document level template, the relationship between other templates. And here we have two important templates. The first one is, of course, the CDA-R2 template. The actual discharge report is based on CDA-R2. And the other is the international patient summary. So if someone have to dig inside the specification and mainly in the art decor, it's very good to have a very good knowledge, or at least to be familiar with the international patient summary and some very important detail regarding this. So here we have an example. I'm not sure if this is somehow outdated, because I know that this is work in progress regarding the art decor, but you can see a big picture here of the document level templates. Of course, we have only the hospital discharge report, additional header level templates, mainly for the header, like the author, the custodian, the legal authenticator, etc. And the most important here is the section level template. We have the information, the medical information, mainly regarding the diagnosis, medication, etc. Each section level template, of course, have entries from additional entry level templates that supported this section level template, like the actual admission, diagnosis, observation, of course, for the reporting, and some additional entry level template, family history observation. So since Sophia made an extensive representation of art decor, I will skip and I will go to the FHIR implementation. When we say,
Nikos,
yes,
sorry to interrupt. Can you go back to the previous slide?
Yes.
If I may have one question. You have this X-eHealth CDA author. Is this the same as the author in the patient summary?
I believe it is. I'm not an expert in the international patient summary. I was not involved a lot in this project, but I believe it is the same.
Yeah, because I think inheritance and reuse of what's already out there makes things, but I'm not sure whether if you click on that you would see that it is based upon the patient summary part.
Yes, unfortunately, this is an image. I have not.
Yeah, sure. Yeah.
I cannot see this, but it's a very good idea to have somehow to make the mapping between some derived component from the national patient summary to the X-eHealth project.
Yeah.
You know,
because that's basically the idea, that you reuse parts of what is already described and not make that a separate thing, because then your maintenance is easier.
Vincent,
Yeah.
I think that's exactly the case.
Yeah.
Discussing with Giorgio and in meetings in Work Package 6 and also in the previous presentation here, it was clearly mentioned that they used quite a lot of components from the IPS. So especially on the hospital discharge letters part.
Yeah. Yes, and I think it's good to mention that. Otherwise, people just get overwhelmed by all this and say, okay, but we have reused a lot of stuff that is already out there. Thank you.
Okay.
Yes, Sophia?
If I can add on that, I don't know if for the hackathon you will have some X-eHealth document also, but we did some mapping between the information model, between FHIR, between CDA, between all the, at least for imaging, we did that. I think it was done also for the other domains, but there are some mapping with the relevant information in different documents.
Okay, yeah.
Okay, thank you very much. So I will proceed, as I told you, now with the FHIR. Some people will say the future is here. So when we say about FHIR specification, we mainly say that we have an implementation guide. So what is an implementation guide? FHIR is a set of rules about especially how FHIR resources are used or should be used. And this can be happened in order to solve a particular problem with, of course, associated documentation to support and clarify the uses. So here, when we say about the FHIR implementation guide, we have information that is not computable, like the human readable part of the implementation guide. And of course, the formal computable actually are some FHIR resources that when we use a publisher, a specific publisher can publish and generate the implementation guide. In order to, some background information here, in order to succeed to have implementation guide, we have somehow what we say the tool stack. With any editor, we compile and create some resources in FHIR. And using a FHIR implementation guide builder, of course, we have we create the implementation guide and we can send them to some registry, like the actual FHIR registry, the official FHIR registry, or the simple FHIR, different FHIR registry. The actual value of the implementation guide is that we can get, of course, all the profiles and put it inside some Java validators that exist, and Gazelle, of course, if and when it will be ready for the X-eHealth project. So since we say that in FHIR we have the representation of the actual document is made using the FHIR profile techniques. So we have the actual FHIR profile here, and this is an example of the layered FHIR profile. So this is not regarding the discharge summary, but is mainly for an observation, a reporting of some lab results. And you can see in the first level we have the blood pressure FHIR profile that is built over the blood pressure standard profile. Its in turn is based on the standard vital sign profile that add constraints to the generic FHIR observation resource, as you can see at the last level here. So how we represent the discharge summary report in HL7 FHIR? We use what we call a FHIR document bundle. It's a special kind of FHIR bundle that have in us the first resource, the FHIR composition. It's actually more or less like the CDA header that you see. It's a very important FHIR resource, the composition. Here is an example you can see here of the composition. This is a part of the documentation, the specification that exists in the FHIR official site for the X-eHealth project, the HL7 FHIR regarding X-eHealth project. We have the representation of the differential table, and here we have the resource, the composition, some information, and you can see here, for example, that we have a reference to the patients as a subject, of course, as the FHIR, the specification of FHIR have to tell us what to do here. We have the reference, the patients from the X-eHealth project, and the actual information, including in slices, that is a technique of constraint some element and presented as list. And you can see here the actual slices, like the section you saw in the CDA header. We have information here also for additional diagnosis, admission diagnosis, medications, section problems, alerts, family history, etc. It's very important also here to mention that a lot of things derive from the IPS, the International Patient Summary specification. So, and here also we have reusable elements that can help us to not to start from the beginning and to create them. So one example here is when we say section allergies, we take, and here we have also the representation of this section. As I told you, the section is a way to restrict some resources, to constrain some resources, and here we have a backbone element. So we have the section allergies, we have title coding. I'm not going to dig into the terminology here.
Nico, we have only 3 minutes.
Yes, of course. This is the last. I believe it's the last slides. Okay, thank you. So here we have. I will not dig into the terminology since this is not also my domain, but you can see how this is analyzed. So if you want more information, here we have the FAIR implementation guide profile. In this link, the input artifacts that exist as code, as resource code at the GitHub, and of course they are the core templates for the CDA. Thank you very much.
Thank you very much, Nikos, for your presentation. I would like also to thank Sofia. Both presentations will be uploaded on the Hackathon website so that everybody can have access and a more thorough look at its content. I would like at this point to remind you that tomorrow there is a professional training session specifically focused on medical imaging and hospital discharge notes. So everyone interested, it's a very good idea that they should watch this training webinar on their screen. I will want to say a few things before we conclude this session. I would like to remind you, and I will share my screen, that the deadline for submitting proposals for the hackathon is the 27th of May. There might be some small extension, but do not consider that, don't take that for granted. So please try to register your application before the end of day of the 27th of May. Next week, we will have our last onboarding webinar, which will focus on the preparation for the hackathon event, and of course the one following that will be on the first day of the hackathon. Alexander, I don't know if you want to add something before we close.
And Hinek has a hand up.
So if not, I would like to thank you all for your participation, and of course, if any clarification is needed in the meantime, please contact us on this email address. Thank you very much, and have a nice afternoon.
Dimitrios,
Thank you.
question.
Bye.
Thank you.
Thank you. Bye.
We all use the, if we want to participate in the hackathon, do we have to register ourselves? Because we are not representing any team, but we just
Yes, you can register, and you cannot you can participate individually or as part of the team. Still, your participation needs to have a name on it.
Okay, so we all would have to register if we want to receive the invitation for that event,
Yes,
right?
definitely.
Okay. Thank you.
You're welcome.
Okay, thank you.
Bye-bye.
Thank you.
Thank you.
Thank you. See you next week.
Thank you.
We'll send more
Tomorrow.
information during the week.
Bye bye. Thank you.
Bye.
Thank you. Bye.
Bye.
Thank you.